Hey Real Self, I'm Dr. Haresh Yalamanchili. I'm joining you live today from the annual facial plastic surgery meeting in Nashville, Tennessee. And I'm going to answer some of your top questions about NeoGraft. Specifically, one of the most common questions we get is what to expect pre and post treatment. NeoGraft, as you probably know, is a really revolutionary technique in terms of creating hair restoration and being able to perform a hair transplant without the traditional scar that we'd see in the old transplants. And so it works well. There are a few things to know about before we go ahead and start this treatment. I tell my patients probably the most challenging thing is dealing with the haircut you're going to need to have. We do have to take hair from the back of the scalp over here, and to do that we do have to trim it real short, almost down to the scalp. And so that's usually the hardest part in terms of recovery, is waiting for that hair to grow back. So my suggestion usually is coming into it about a month before, I have my patients get a summer haircut, I call it, where you get to trim it real short, especially if you're not used to having a short haircut. That way everyone in the office, everyone at home kind of expects this new haircut. They kind of get the initial surprise that you've changed your hairstyle, but then it looks pretty normal when you come back after the transplant with shorter hair. After the fact, the hair grows back here, and within about usually 10 to 14 days, after about a week or so, I let my patients kind of blend it in with the rest of their hairstyle. And so really the recovery for this in general is about 10 to 14 days before people can get back into circulation. I'd love to answer any of the questions you have. Feel free to visit my profile and leave me a question. Otherwise, I appreciate your time, and thanks so much for paying attention.